Good morning, my friends. How are you? It's your old pal, Buddy. How's everybody doing? I hope everybody's doing well. I really do. But today is a very special day. Today I'm going to the veterinarian. That's correct. I'm going to see my physician, my personal physician, Dr. Kenneth Triplett. That's correct, my friends. Yes. And the beautiful staff that works there. But I have to have some procedures done. And if the doctor is, will let me film this, well, Mommy will have to film because I'm going for laser treatments and I'm having thermal imaging. So I just thought you might enjoy seeing what it is and the kind of treatment I am having. All right? I hope the doc agrees to this. Well, he should. I'm a convincing sort of fellow. Oh, my goodness. All right, come along with me.
Is a thermo digital camera, and it shows us where his injuries are. So it'll light up red wherever it's bothering him, where he has pain, and then I know where to go with the laser to concentrate to help him better.
Great.
Okay? So just stand still, buddy. And I take a bunch of different angles so that I could see his knees, his legs, his back, wherever it is that he's exhibiting pain.
Okay.
Okay? Because they can't tell us where it hurts. Right, buddy?
Stay right there, handsome.
Perfect.
Stay right there. No. Stay right there.
Okay. Gonna come on the other side.
Stay there. Stay there.
You just get down in here. Okay, now I gotta get a back shot. I always wanted to be a photographer. You're gonna have to move him because I need a view this way
Okay. Hold still.
and go that way with him.
Hold still. Going right ahead.
Good job.
Right here?
Yep, that's fine. And I need you to stand, buddy.
No, you gotta stand up.
Perfect.
Dr. Triplett, I'm with the West Hazleton Veterinary Hospital. We're trying to get Buddy up and moving again. And part of that is to assess to see how well our current treatments are working. One of my favorite tools for doing that is called the Digitherm. It's a thermal imaging system. And it actually shows us where hot spots are, where places that are bothering animals might be. Because they obviously can't tell us.
Right.
So what we do is we take pictures of them, and then this computer here tells us what temperature is actually coming off of his body.
Okay.
Basically, when we look at these things, green is good for a dog.
Okay.
Yellow is a little bit bad, red is bad, white is very bad.
Okay.
The other color we look for is blue. If there's blue there, it means there's less circulation in the area, which sometimes happens with chronic injuries.
Right.
Now for Buddy here, we've actually been treating his back for a week or so now with the laser. So we wanted to see how well the treatment was working. So this is a picture of Buddy's back. And as you can see, it's mostly green. Now, the first time we did this area where you see these little yellow spots and that one red spot right there, the first time we did this entire area was either red with a little bit of white in it.
Really?
So the treatment does seem to be helping quite a bit. His back is getting back to normal. We know that the Digitherm is working because where the technician's arms are exposed, you can see there's a lot of heat coming off of those as compared to Buddy. The places that seem to be bothering him right now are further down his sides. So this is below the back injury. And a lot of dogs do have compensatory. When they don't want to use their back, they try to shift their weight to other parts of their body. So that'll sometimes cause that.
Right.
So the good news is we are helping his back. The bad news with disc injuries is we don't know what direction the disc went in when it went out of place.
Okay.
The only way to really tell that would be to do a CT scan or an MRI type thing, which we can't do here.
Right.
So yeah, at this point in time, we need to keep treating Buddy and hope that over time he continues to improve.
Okay.
I can tell you the average recovery time for a back injury is at least a month.
Okay.
So we don't give up after a week.
Right.
And Buddy is, when we first saw him, he couldn't stand or walk at all, so he is doing better. Maybe not as well as Mommy would like.
Yeah.
But
Okay.
So yeah, basically we're going to do another treatment today.
All right.
And we will probably reduce treatments now since we've had such a good response to treatment.
Okay.
We'll probably reduce treatments to maybe twice a week for the next week.
Yeah.
And then go to once a week after that.
Okay.
Just to keep things, we want to keep the inflammation at bay as much as we can during the healing process.
Right. All right.
So that's the plan.
So we're getting ready for our laser treatment. There we go. There's our bud. There's Miss Beautiful Pam. Thank you, doctor.
You're welcome.
And I'm going to ask you to put these on to protect your eyes.
Okay.
Or not look at the laser. Just don't look at the laser.
Well, we're going to record that.
Alrighty, Miss Pam, I am ready. Oh my, don't you love the goggles? Well, I have delicate eyes, that's correct. All right, Miss Pam, let's begin. You may tell everybody what's going on over here.
And this actually feels really good to them. It's a nice, soothing heat. And I use it on myself. Good guy. That feels good, huh? That feels real good.
And usually, how long do you do these treatments for?
So, you mean
Individual, yeah.
Each session for Buddy is taking me about 15 minutes because I like to do it 2 separate treatments. So when this one's done, I'll restart the machine and I'll do another one on him.
Okay.
Just so we could get him moving a little quicker.
Right. Well, thank you, Pam.
You're welcome.
Is there anything about this machine, anything else you could tell us about laser treatments?
So laser treatment actually is so beneficial for arthritis. It does so many things. People think it's just for inflammation. It's not. We actually use this after a dental procedure on an animal,
Really?
especially when we pull tooth to lessen the inflammation during recovery time and to stop the bleeding. You know, in a human, they can suture us, the dentist, or they pack the gauze up in there to make sure it doesn't bleed. The laser takes care of all of that. It's we actually use it too after all surgeries on the incision, so it reduces the pain and the swelling at the incision site, so the recovery time's a lot faster.
And how many doctors in our area are actually using laser at this point?
So in our area, I think the next doctor to use this specific laser machine, this is a state-of-the-art one, so the next doctor to use this is about 60 miles away.
Wow.
Yeah.
And I like it because it's not invasive.
It's not invasive and it doesn't hurt them at all.
Oh,
It's
yeah.
so comfortable to them.
I mean, you can see Buddy's not even moving. He's enjoying it.
Right. We actually have St. Bernard that comes in weekly for her laser treatments because she's older. She's 11 years old, and you know, big dogs like that, their arthritis sets in. It's harder for them to become mobile. And
Right.
so she started seeing us for laser treatments a few months ago, and the owners noticed a difference after her 3rd treatment. Her muscle tone has come back in her hind legs because she is more mobile.
Right.
And it's funny because now when they come, I tell her she's getting her spa treatment. I have a bed back there for her because she's so big. She walks right back to the bed and just lays down and waits for her treatment.
Wow.
Yeah, they love it.
Well, it's very comforting. I could see my dog is not having a problem. He's just
No.
sitting there.
No.
He gets a little nervous, but not too bad.
Yeah, no. And I think it's just being in the
right.
different environment at the vet, they get a little nervous. But no, it doesn't hurt them at all.
That's great. Thank
Yeah.
you, Pam, so much
You're
for showing
welcome.
everybody this procedure.
You're welcome.
Now do you see what I mean with Buddy says he has many girlfriends? There's Miss Pam, Miss Beautiful Pam, and Miss Beautiful Danica. That's your assisting.
And not everybody gets personal use of my computer. Only you do.
You hear that, Buddy? You want to say that again? What is Buddy?
Buddy's the light of the internet.
Words of wisdom.
He's got, yeah, that's right. He has words of wisdom, our Bud, the little general.
He brings a smile to everyone's face.
But I'm really happy, like, people are seeing this because they're seeing that there is no pain or nothing to the animal.
Oh, no.
You know, he's not crying. He's very relaxed.
You know, it's strange, but I tell people this all the time. We truly do feel like there are animals. And the way we look at it is, if it was one of our animals in someone else's hands, we would want the same kind of treatment.
Right.
You know?
Absolutely. Well, we're done, and we're heading home, Buddy and I. And I wanted to do that. I asked them if I could film them, and Pam was so nice, and Doctor was so nice, to show you all what it is that they were doing for Buddy. Because Doctor just said we don't have to see Buddy twice a week. Now we can go down to once a week. So that's a good thing, and I'm really happy about that. So he's right over here. He's trying his hardest. He's not supposed to try to do this. Look, see what he's trying to do? Anybody? He wants to put that whole snoot out the window, but that's not happening. So thank you guys. I wanted you to see this. I really did want to see. You love Buddy so much, and I know you do. Buddy, do you want to say anything?
Yes, I'd like to say something. Oh, for goodness sakes. Dr. Triplett! Dr. Triplett! Thank you very much, my friend. Oh, my goodness! I can't begin to thank you. The West Hazleton Veterinarian Hospital is the best hospital ever. Yes, it is. Yes, it is. You know why? Because of the staff. That's correct. The staff. And you heard what they were saying. Oh, yeah. They treat me like I'm family. Like I'm one of their own. That's right, Miss Pam. That's right. I'm in the best of care and the best of hands. And as you can see, no pain involved. Absolutely no pain involved. It will take me a moment. That's for sure. It will take me a moment. But you'll see, I'll be back to normal in no time. And well, listen, the brain's not gone. You know that. So I'll keep rambling on. But I want to say thank you. And I hope you enjoyed the presentation. I really do. Because a lot of people don't know what laser treatments are all about. And thermal imaging. That's correct. Anyway, my friends, just know I love you. And I'll see you all so soon. Bye-bye. Come on, Ma, put that pedal to the metal and let's go.